There are many anti-diabetic drugs currently available in the market. What are they, and how do they work? It's time for a quick review. Let's begin with metformin, the first-line medication for management of type 2 diabetes. It works by inhibiting gluconeogenesis and is an insulin sensitizer. Metformin is generally well tolerated, but it can cause nausea and diarrhea. Remember, do not use metformin in patients with severe kidney disease. Next up, we have GLP-1 agonists. They are incretin mimetics and potentiate glucose-mediated insulin release. Some of them have been shown to have cardiovascular benefits and cause weight loss. Most of the side effects are GI-related, with nausea being the most common. Pancreatitis has been reported as well. Do not use this class in patients with history of MEN2 syndrome or pancreatitis. The next class are SGLT2 inhibitors. They block renal glucose reabsorption and promote glucosuria. Some of the medications in this class have been shown to slow progression of CKD and have cardiovascular benefits in patients with heart failure. Most common side effects are UTIs and genital mycotic infections. Cases of euglycemic decay have also been reported. Up next are sulfonylureas. They work by increasing insulin secretion. They're an inexpensive class of medication. Since they increase insulin secretion, there is risk for hypoglycemia. They cause weight gain as well. Patients with kidney disease are at increased risk of developing hypoglycemia. Pioglitazone is an insulin sensitizer in peripheral and hepatic tissues. It can, however, cause edema and can cause or exacerbate CHF. Its use is therefore contraindicated in patients with severe heart failure. And finally, we have the DPP-4 inhibitors. By inhibiting the activity of this enzyme, they increase the incretin levels. Side effects include nasopharyngitis and nausea. Rare cases of pancreatitis have been reported. Metformin remains the first-line therapy for type 2 diabetics. Subsequent medications are based on patient characteristics. If CVD risk is high, then GLP-1 agonists are preferred. If heart failure or CKD predominates, then SGLT2 inhibitors are preferred. The cost of diabetes medications is increased tremendously. And if cost is a major factor, sulfonylureas can be considered. And that concludes our quick review of non-insulin therapies.